Hey guys, how's it going? I want to quickly discuss about sepsis criteria. See, physicians have been trying to figure out how sick a patient is by looking at their vital signs and everything for the past, several decades. And there is this SIRS criteria. Do you know what is SIRS? SIRS, all caps. Systemic inflammatory response syndrome. First, you need to rule in that somebody is having a systemic inflammatory response syndrome. You look to see if their heart rate is more than 90, and then look at their respiratory rate. If it's more than 20, then it means it's high. So just these two things. So you already got the criteria for systemic inflammatory response syndrome. And then there are two other stuff. Temperature, is it more than 100.4? And then is the white cell count elevated more than 12,000? So if you just answer yes to all these four, then they got a pretty good systemic inflammatory response syndrome going on. Can be because of various things. It could be because of heart attack, it could be because of trauma, they fell and broke their hip, or they could be having a clot in the lungs. So many things can cause it. So then how are you going to rule in infection? So that's where the sepsis criteria comes in. Once you establish the SIRS criteria, then you look at the patient and see if they got any obvious source of infection. Lung sounds that indicate that they got a big pneumonia going on, or a urine that shows clear pus. So once you find a clear source of infection, then now they're ruled in for sepsis criteria. And once they're positive for sepsis criteria, then do they have severe sepsis? And the way you identify that is by looking at their lactic acid level. Their blood pressure, is it lower than 90? Or was the blood pressure drop more than 40? Like, are they now 140, but previously 6 hours earlier, they were 180? And then they dropped the blood pressure without any intervention. Then that is just not good, because maybe they're headed towards hypotension. Can you believe that? I mean, how they've evolved all this criteria. So once you rule that, in, like looking at the lactic acid level or the blood pressure less than 90, then it means that they got severe sepsis. And then once they got severe sepsis, then you still have to further decide, do they have septic shock? Because by now, hopefully you're giving them fluids. And are they responding to fluids? And if the blood pressure is getting lower despite fluids, then that's septic shock. And then the last thing is, multiple organ dysfunction syndrome, MODS. Do they have, elevated creatinine? Is their kidneys failing? Is their liver failing? Once you establish all that by looking at their blood counts, then you know that they got multiple organ dysfunction syndrome, and those are patients that go to ICU. Amazing, isn't it, how they've established all this? And this came up in 1991. A bunch of doctors sat on a committee and they voted all this, and what they decided at the time, it really rules good even right now with a little bit of modification. Amazing, isn't it? I'll talk to you later in my next post, guys. Goodbye.